to everyone. It is indeed my pleasure and privilege to stand here and welcome each one of you. I wish to welcome dignitaries on dais, Dr. R Balakrishnan, Director Cardiac Sciences and Heart Transplant Faculty members, colleagues, friends. Today we are gathered here to we have done a bilateral lung transplant for a rare clinical condition, which is performed by our team of doctors, Dr. R Balakrishnan and Dr. Suresh Rao and their team members. Just like to brief little about Dr. R Balakrishnan. Dr. R Balakrishnan, with the experience of more than 30 years, has independently performed more than 16,000 heart operations, and he has conducted over 150 heart transplants, which we already explained to all of you 1 month back. And he is considered to be one of the best surgeons for heart transplant in India.
We did a bilateral lung transplantation for severe pulmonary artery hypertension with right ventricular dysfunction. Now, bilateral lung transplantation is not very uncommon, especially in this part of the city. Several transplants have been done. But what is special about this case is that bilateral lung transplantation is done for primary pulmonary hypertension. This is the first of its kind in this part of the continent. First on the right side, then on the left side. Here you can see anastomosing the lung. Basically there will be 3 anastomoses. First we did the transplant on ECMO support. You can see the chest X-ray here. The first one is implantation, even though he had right ventricular dysfunction, which eventually has improved. Alright, he can climb steps. His symptoms have improved.
Very high pressures in the lungs or pulmonary hypertension is a rare disorder, but in terms of, you mentioned 15 per million, but since we have 1.2 billion people, the actual numbers are quite high. And it's a very disabling disease. Over a period of time, when the right side of the heart starts failing, as it was with this boy, they invariably die. There is no future at all. Even though medical treatment has made a lot of important advances. The reason we thought we'll highlight this is traditionally, when the heart function is so poor as it was in this boy, the approach has always been to change both heart and lungs together. But with Tamil Nadu having such a busy and successful heart transplant program, getting a heart and lung block together is very difficult. There's always other patients who need a heart separately. So there are only 2 or 3 groups in the world which are treating this kind of severe right heart failure with lung transplantation alone. And we felt that this is the only way we are ever going to be able to get an organ for this boy. Because with rare groups, sometimes you have to wait for up to 1 year, and there's no way somebody with this kind of disease can sustain for that period of time. Ensure that maximum number of people benefit. But even though the operative part of this is difficult, once they survive the operation, their long-term survival is excellent. And these are young boys and girls, so they can go back.
Doctor, look at please, sir.
Sir, just interact with me. Please.